Good afternoon. My name is Mary Jo Constant. I am here to inform you about the virus called HIV/AIDS. What is HIV? HIV is a human immunodeficiency virus. It's a virus that attacks the immune system, which is the body's natural defense system. Without a strong immune system, the body has trouble fighting off any type of diseases. Both the virus and the infection it causes are called HIV. When an individual diagnosed with HIV, it does not mean that the individual have AIDS. Even without treatment, it takes a long time for HIV develop into AIDS. Its progression usually takes 10 to 12 years. According to research, when HIV diagnosed before it becomes AIDS, medicine can slow or stop the damage to the immune system. The immune system will return into its healthier state. HIV has caused over 19 million deaths since its first recognition in 1981. And it's prevalent worldwide, and it affects all ages. Therefore, there is a need for all people to be wary of the infection's immense impact in the society, thereby coming up with remedies that can decrease its transmissions. Today, HIV/AIDS is still a threat to social and economic development in our society. This is the reason why I think it is important to discuss this topic, because I have been captivated by the rapid spread of the HIV virus across the globe. And I feel some remedies need to be taken to bring down its spread. It is sad to say that I have known and dealt with people that have contracted the virus and died from it. Since then, I started research on the virus. I've studied it. I read collections of books about the disease, calling HIV and AIDS. I research on the internet and search other publications and try to know a lot of information about this deadly disease. How do you get HIV? Predominantly, AIDS is an epidemic infection. It's transmitted through sexual relation, intercourse, body fluids, infected blood, sharing drugs, needle with someone that is infected with the virus, calling HIV. HIV has been a threat worldwide for quite a long time. The first HIV case in the United States was experienced in 1981. The average life probability for AIDS diagnosed victim was 1 year to 6 months from 1981 to 1987. Since 1981 up to 2005, nearly 1.1 million victims have reportedly been diagnosed in the United States. The number of people with the infection was on the rise, and so did the population dying from it. Yes, a lot of people have died from that virus because we were in the dark. The acquired immunodeficiency virus, which we call HIV today, that term was first used in 1982 in a description of the deadly disease. The first HIV clinic was opened during that time in San Francisco. In 1985, America has lost Rock Hudson to complications associated with AIDS. In effect, Hudson has willed $250,000 to help develop American Foundation for AIDS research. Today, the foundation funds education and research globally. By 1994, HIV/AIDS had become the most killer disease among Americans of ages between 25 and 44 years of age. In 1987, the antiretroviral drugs become the standard treatment for the epidemics. In effect, the number of deaths began falling, cutting it nearly half in a year. In the year of 2002, HIV test kit was discovered. However, the epidemic does not have a cure yet, and once you are infected with the virus, it is impossible to get rid of it. The virus can be treated through drugs, but only thing that it does, it slows down its progressions. Economically, how do HIV affect the economy? How do HIV affect the economy? The world social and economic development have been affected by HIV and AIDS because its growth in those areas has been a reduction on human capital, the availability of proper prevention, education, nutrition, healthcare, and medicine that could be available in different countries have not made it to other parts of the world, and therefore a large number of people have been falling as victims to this disease called HIV/AIDS. People living with HIV/AIDS will not only be unable to work, but will also require significant medical care. The forecast is that this will probably cause a collapse of economy and society in countries with significant AIDS populations such as Zimbabwe, Kenya, South Africa, Uganda, and Haiti, and other countries. In some heavily infected areas, the epidemic has left behind many orphans. The increased mortality of this region will result in a smaller scale population and labor force. This smaller labor force will predominantly young people with reduced knowledge and work experience leading to reduced productivity. It is further to say that an increase in workers' time off to look after sick family member and other sick loved one, lower productivity, and increased mortality. Also, I can say it also weakens the mechanism that generate human capital and investment, and people to loss of income and the death of a parent or a loved one. We can also examine healthcare, resources, education, and poverty. The public health experts and economists have shared a common dissatisfaction toward previous economic analysis, the impacts of HIV/AIDS. There are a lot of evidence that show a better understanding of the economics and social dimension of the epidemic, and it showed that poverty contributes to HIV/AIDS. It is fair to say that the government action shall be designed and intervene in view of the risks with health and education. What about healthcare? The medical experts and scientists have tried their best to discover the cure to the infection, but their efforts have been futile. To this end, if they have only come up with vaccines that make infected people feel better, feel stronger, essentially the risk of contracting HIV can reduce to making changes to sexual behavior, promoting and educating people on abstinence and condom use, the effective use of condoms prevent transmission of HIV by almost 100%. On the other hand, antiretroviral therapy strengthens the immune system and avert the infection that kills the AIDS victim. These drugs enhance maintenance of quality life and exhibit normalcy in the people infected. since they are able to take care of themselves, like those without the infection. Meanwhile, HIV/AIDS tests and diagnosis of the victim help encourage those infected to seek treatment and maybe change their sexual behavior. Most importantly, for people who are not infected with the virus, prevention is inevitable, especially by abstaining from sex, condoms use, and stop sharing needles and drug use. Evidently, putting expectant mother on antiretroviral therapy decreases the probability of transmission of HIV virus to the child. Such programs discourage breastfeeding because there is a likelihood of the virus transmissions to breast milk. Prevention of mother-to-child transmission program is a short treatment that prevents an infection. Ideally, antiretroviral therapy must be administered indefinitely and progressively for adults. Prevention and mother-to-child program often recommends food as an alternative to breast milk. And there is a need for the government and non-governmental organizations to hasten the pace of coming up with remedies, such as creating awareness about HIV/AIDS globally. By doing this, HIV transmission rate can be decreased, thereby enhancing economic and social development. HIV/AIDS is still a real threat to social and economic development today. In principle, HIV have become an epidemic, and in fact, numerous lives have been lost due to the virus, and a huge number of people have faced disruption because of the suffering and pain of the people they love. Currently, nearly 40.2 million people are HIV victims in the whole world, and the number seems to be on the rise. Additionally, the massive nature of the disease has caused hysteria, fear, and a myriad of misconceptions about the infection. Consequently, the infection has caused discrimination and stigmatization on the ones affected around the planet, and we for HIV and AIDS transmission to decrease discrimination and stigmatization ought to be addressed. In return, social and economic development can easily be attained. I thank you for your prompt attention, for listening. I'm open for any question you may have. Thank you.